Thank everybody for coming. We have members of the Board of Supervisors who is on the Budget Committee who's going to come out here and answer your questions directly, which is good. We also wanted to let you know these people are here for the ceasefire. We want to let you know SEIU1021 COPE, which is the political wing of the union, voted to support of the Palestinians. And today, at the Board of Supervisors, they will be considering whether they will pass it. But most of this is for you guys because we're on the bargaining team. I'm on the bargaining team. Louis here is on the bargaining team.
I'm Luis De Jesus. I'm on the bargaining team. This is my first year, so I am absolutely learning. But I want to say I am for the people, and it's unfairly for us DPA city workers working for healthcare to get unpaid, to get treated unfairly. And I just think like if they want to give the police department extra money, they should also think about healthcare workers because we're on the same pedestal. Nobody's higher than anybody else. So all across the board, let's just keep it even, Steven, if possible.
And what are the conditions? Do you need more help? Do you need more support?
For the hospital DPH, we're understaffed. We're understaffing, so we need more staffing. If they could hire permanent instead of as needed people, that would help out staffing.
But why did they say they can't hire permanent people? What's their excuse? What's their justification?
Their justification for not hiring people is HR's involved.
Oh, so HR is not doing the hiring.
HR.
Human resources.
Human resources. That's who's involved now with the hiring process, and they took it away from the actual managers and EVS because of the hiring procedure or something. So HR took over, but now they're not. They just.
So the Civil Service Commission, which is supposed to do oversight over hiring, that kind of thing. I mean, their hearings, that's been brought up before. Workers have gone to the Civil Service Commission. What's happening with HR? Why don't they hire permanent people?
That's true. We're asking the same question. Why aren't they hiring other people? That's what we need to know. That's the question.
Because the living cost is getting higher, and every company, every organization, they raise their labor rate already. So of course I know our pay is okay, but everybody they finding their salary getting higher because some of the unions said they have equal work, equal pay. Actually they fired it, they got it. Congratulations. And I also our job is really high risk, right? Sometimes needle stick, infection flu. So you know what? All about this one, we think we deserve pay. Has to pay more about that, and we would like to have better benefit. I know school districts have really good benefit. They have a living allowance. They have a more holiday or floating holiday. And they have insurance, even though insurance they pay less than us. 1+1, it was free, but even though right now they only pay $13 for each, but we pay more. And then they have sometimes every year they have to pay $1,000, over $1,000 for the allowance, or what, I don't know, with supplemental something like that. But we don't have it. But last year, this year we got a little bit, but I heard about we don't have that much allowance, so. Which is we are essential worker, we always working hard, and it's pretty dangerous sometimes. So I think we deserve pay a little bit more and have good benefit. That's why I get because our hospital job. Even though me sometimes I get the blood splashing into my eyes, those are very high risk and infections. So I heard some our current co-worker, they have needle sticks. Yeah, we are high risk. We deserve to pay more.
You do?
Yeah.
And we want a decent contract. We all have worked really hard. We put in a lot of extra time And you know, people like me on my job, come early, stay late. They don't pay us. We do it for the patients. That's who we do it for. And so they need to recognize that. They need to support us for that. And now they need to pay us our just due. I was just talking to some of the people in housekeeping, and it is a dangerous job. People don't acknowledge it. People don't give them credit for it. But the pay needs to be equivalent for what they're doing.
I'm a physician here. We're here supporting you all as part of the Healthcare Workers for Palestine. The reason that we're here is because we are saying that we have too much investment in military, in police, not in life-giving, life-saving services. So that is why we're here in solidarity with you all, because all of our causes are connected. So let's take our money out of war, let's take our money out of bombs and bullets and invest in our communities.
Yeah.
Thank you all so much. It's an honor to be with you all.
Oh, thank you.
Well, on the nurses' behalf, you know, our staffing, we're always short of staff. So, you know, by us getting a contract and having the money to hire nurses and get the staffing back up to par, that would be great. And subcontracting, we got to get rid of that. Okay, we have to do that. They just cut out some services for some of the contracts that we had. They're cut their services out. Now they have to go other places to receive their physicals. So you know what? We need to vote on this contract, and we need to have a good contract. So it's a good idea for us to go out and tell everyone else to vote and get a good contract.
As needed?
Forget as needed. We need full-time permanent positions. So go SEIU, fight for that contract.
Community supporter.
Yeah,
This is a guy from the community here to support us.
I'm also a SEIU 2015 member, so we're sister organizations. But I'm very concerned about the budget, where we've been going, where things are being privatized all the time. And there's a lot of waste in that privatization. Hundreds of millions of dollars going to pay duplicative management services and going largely there and not to meeting the needs and backing up our city workers on the job. And we've got to switch and stop this trend towards privatization and the non-profit so-called taking over city work and business. It's huge. It's, you know, constantly there's new contracts going out to people, and often they're having to be policed because they're not doing the job. Outrages are going on in this sector. That money needs to be coming to SF General, to our other healthcare delivery, and not be going to private managers who are supposedly nonprofit public workers. So we got to do that. Also, I have voter registrations. There's a presidential primary coming up on March 5th, and there's a magnificent candidate running, Dr. Cornel West. He is running on the Peace and Freedom Party. You need to register Peace and Freedom by February 20th. We need to show and register our positions in this primary so that we can get those positions enforced into the powers that be. Yes, so please I have, it's free. You don't even have to buy a stamp. Okay, thank you.
And right now their pay is not equivalent for what they're doing.
It's true.
We need to improve that. And a lot of people are short-staffed. We don't have enough staff to get the things done the way we want to do it good for our patients.
Yes.
A lot of us cringe sometimes when we come to work and there's not enough people for us to do a really good job. We just do what we can, but are we really doing what we want to do? No, because we don't have enough people to do it. So we do the best we can for our patients.
And why are we here?
And we are here because of the patients. That's what all this is about. But even though we're here for the patients, the city doing things like wanting to give the police $300 million out of the general fund, which is where our wages come from. It's not okay. So we fought that off, thank God. Something else is going to be on the ballot, but we need you to know, when it gets to the ballot, people who live in San Francisco need to vote for it. Because the alternative is them giving $300 million off the top to the police before we get a nickel. And that's not okay.
Not okay.
Not okay. We all want to be safe, but we need safety and fairness.
Yes.
Is what we need.
Quality.
And quality. And that's what we want to do for our patients. We're all DPH, but this is going to impact people all over the city. It's going to be a big fight. And we have to know that at some point, I'm telling you guys all get ready. We might have to strike. So get your finances in order. Get your money together, just in case we have to strike. Because if they refuse to give us anything, we're not going to accept it. The bargaining team will not accept it. All right. So we have people here. Asha.
Well, listen, I can't believe we're in this position, actually, because for the last 3 years, we've had thousands of positions that are funded in this budget, in DPH's budget, unfilled. You know what we did a week and a half ago at the Budget Committee? They took $40 million that was designed, in this case, for nurses assistants, medical assistants, and they transferred all that money into overtime. Those were all designated dollars to hire to support General and Laguna Honda. This mayor is failing our city right now. This is not something that happened overnight. This is something that has been building for the last 3 or 4 years, and you all are the ones that are bearing the brunt of it. You all are the ones that are stepping up, first during COVID, and then now over the last couple years, to do all the additional work, do all the additional overtime, and put your lives on the line in some cases, and your mental health on the line in every case. So I'm here today. I've been working with nurses. I've been working with frontline workers like Brenda and Ingrid and others, because we need to make sure that you all get the contract you deserve, that you get the respect you deserve, and that you get the staffing levels that you deserve.
So he can't answer any questions.
I don't know what else to say, but I'm here to support you all. And then I also have a gentleman. His name is EJ Jones. EJ, come on up here, EJ.
Come on up here, EJ.
With your backpack and everything. EJ is running to replace me at District 11 to continue to fight for working families. Born and raised in the city, grew up in Lakeview, OMI, and I think he'd be a wonderful person to replace me on the Board of Supervisors when my term ends next year.
Well, Carol Ison, what's happening with the Human Resource Director?
What do you mean? What's happening with?
That's their job. Human Resource Director.
Well, the mayor, just so everyone understands, the question is, why hasn't HR hired? The mayor is the one that proposes the budget. The mayor in our city charter is the one that makes final decisions on funding and spending. And so at the end of the day, we need to work together to make sure. Now we're facing an $800 million budget deficit. Now we're thinking about things like public safety, but we can't do it just in terms of police. We have to think about it in terms of nurses, firefighters, sheriffs, medical assistants, janitors, everyone that's involved in making sure our city is safe. So that's the next thing that's going to be on the ballot.
Hazard pay?
Hazard pay, I know that's something that's negotiated on behalf of your union. That's something that you all would do on behalf of your union in the city. I think it's something that's been discussed before. The thing that frustrated me last year when we went through the budget process, particularly for nurses, was they had an ability to apply for hazard pay at the state level. All they had to do was send in the application, and they didn't do it. And it was frustrating. It's frustrating.
But they had the opportunity to do it.
They did.
Yeah.
They absolutely did.
Yes, the janitor's quarters, he didn't have the opportunity.
Yeah.
So that was very unfair there.
Just know that you have a friend and a brother in this fight here with me, and I'm here to support you.
Thank you all for coming. On January 17th is our bargaining kickoff rally. It's going to be at City Hall. There's going to be buses that will take people here from 12 to 1. Just get in touch with Daniel if you want to go, so they can make sure there's a seat on the plate. They will have lunch. They will have T-shirts that they'll give out. It should be a serious event because we really want our pay, but we have to make a big showing.